All right. Hi, everybody. I'm Vanita Litback from Speechy Side Up. We're going to let people sign on. You guys are really smart to jump on early because this is a limit of 100 participants. And the last one that I did, we didn't have anywhere near that. So I didn't think we would get that close, but I think we're going to exceed that. So I do feel bad for anybody that wasn't able to get on tonight. If you have friends, we will be doing a recording of this and releasing it on the Speechy Side Up podcast. And I'll also share information if those individuals need CEUs, how they can get those as well from the recorded playback. But we have actually hit our limit, which is pretty cool. This is obviously a really hot topic. So thank you, Lauren, so much for agreeing to do this interview with me. This is actually the second interview we've done, you guys. Lauren was nice enough to agree to do the live version with question and answers so that you guys can get your questions answered, on the spot. And it's going to be amazing. So the title is Read Between the Lines, Understanding and Treating Dyslexia. So for the agenda today, we're going to do some brief introductions and backgrounds. Then we're going to talk about working with children who have dyslexia in the public school setting. Then we'll talk about the Orton-Gillingham approach and the 6 principles. Then we'll talk about treating dyslexia in private practice and what you need to consider. Then special considerations that you need to keep in mind when treating this population. Lauren's favorite go-to resources, and we'll wrap up with a live question and answer discussion. But like I said, feel free to ask any questions throughout. When Lauren is done talking about a particular topic, I'm going to present the questions to her and she will answer them for you then. That way she can keep focused on the topic at hand and stay on track, right? So if you're not familiar with me, like I said, my name is Vanita Litback. I'm the host of the Speechy Side Up podcast. I have a passion for AAC, literacy, and assistive technology. I have had the privilege of presenting some poster presentations at ASHA and having 2 articles published in the ASHA Leader. I'm also a co-author of the Lou Knows What to Do social book series. And I'm a new mom to a 7-month-old daughter who is peacefully sleeping right now in her bed. And this is my guest, Lauren Klein. So Lauren, go ahead and take it away.
Okay. So my name is Lauren Klein and I am here in Colorado. I'm about 15 minutes outside of Boulder. I grew up here in Colorado and then I actually moved to Boston for graduate school. After graduation, I worked for 3 years in a language-based learning disability program in a middle and high school outside of Boston. In 2017, I moved back here to Colorado, and in 2018, I started my own private practice. And I've actually spent the past 1.5 years taking the coursework and completing my practicum to become an associate member of the Orton-Gillingham Academy. I currently work about 20 hours a week in my private practice, and I spend the rest of my time with my 2 girls. I have a 3-year-old and a 1-year-old. And actually last February, February of 2020, my youngest daughter, Grace, was diagnosed with hydrocephalus, and she had brain surgery last August to help treat it. And since then, she's been doing absolutely wonderfully. And I've just kind of been busy, being a mom and also throwing myself into Grace's therapies. She gets PT, speech, and OT. So it's a really nice balance of both working and hanging out with the girls.
Awesome. Thanks, Lauren, for sharing that and being transparent. I've actually really enjoyed following along on your journey with Grace and just seeing what it's like to be on the other side. It's really eye-opening for a therapist, I think, to just see how the parent actually feels in those situations. And you've just been so transparent. So thank you for that. And we're going to share Lauren's social media handle so that you can go follow her and meet Grace and learn more about dyslexia, from here on out. But we'd like to learn more about you guys as well. We do have some giveaway prizes at the end of this, 2 TPT gift cards. So just stay active in that Q&A and chat today. But go ahead and enter what state you're from or what city. And you said you're in Colorado, Lauren. I'm in South Florida. We have a lot of, okay, so I see Miami, Pennsylvania, Michigan, Canada, Louisiana, Florida, another Florida, California. Wow, you guys are from all over. Yeah. I know I had some people reach out to me from South Africa. They're like, I really want to attend, but I'm in South Africa. Oh, I have a Pembroke Pines That's really close to where I
Oh,
am.
Malaysia. That's amazing.
No way. I didn't see that one, but that's really cool. Awesome. Can you guys go ahead and share what setting you're in? So are you in the school setting, private practice setting, other type of setting that we're not mentioning? A lot of schools. Wow. A lot of school.
Yeah.
I don't even know if I saw a private practice setting, but
I
a lot
saw
of
a
people.
couple, and I feel
Okay.
like a couple people who do both too.
Okay. Awesome.
Oh, I
Yeah. That
also
makes
have a
sense.
daughter with dyslexia. Thanks for sharing that.
Oh, that's great. Yeah. She'll probably be able to provide some a good perspective throughout this too.
Yes, certainly.
And now I'm like realizing how many people we have on here. It might be better if if you guys have questions, to drop them in the Q&A and not the chat, because I'm afraid we'll miss it. We'll do our best to catch it in the chat if you happen to put it in there, but I would say put your questions in the Q&A. That way we can actually make sure we answer those. All right. So we have to talk about this stuff since it is an ASHA approved pod course, and we'll talk about at the end how you can earn ASHA CUs if you're interested. But some disclosures, I have the following relevant financial relationships to disclose. I have ownership interest in Speechy Side Up LLC and Tassel Learning LLC, and I receive royalties from the Lou Knows What to Do book series. I have the following relevant non-financial relationships to disclose. I'm a member of ASHA's Special Interest Group 12. And how about you, Lauren?
Yes. So I have ownership interest in Lauren Klein Speech Therapy LLC and my Teachers Pay Teacher store, but I do not have any non-financial relationships to disclose.
All right. And then we do need to disclose that this presentation will focus exclusively on the Orton-Gillingham approach to dyslexia and not other related approaches. All right, so our learning outcomes for today, hopefully by the end of this presentation, you'll be able to identify 3 strategies for working with children with dyslexia in the public schools. You'll be able to define the Orton-Gillingham approach and identify the 6 foundational principles, describe 3 treatment methods for working with children with dyslexia in private practice and what to consider. And then 3 special considerations that you need to keep in mind when working with this population, as well as 3 resources for working with children with dyslexia. All right, now we get into the fun part, the interview. So we did have a couple questions come through. Actually, one question so far, and it says, what is the best way to complete the Orton-Gillingham certification? I think you're going to be able to address that coming up, right? So we'll hold off on that, Anna, and then get back to you.
But yes, that's a great question.
Yeah, it is. And I think this is probably going to be where you address it. So how does an SLP specialize in dyslexia?
So my first question, and if people want to answer in the chat again, is totally fine, but kind of talking about how I was able to get my start in it. And I'm curious if other people had any experience either treating dyslexia or took courses related to dyslexia in grad school. So if you did have experience with it, go ahead and share in the chat if you had any experience or took any classes on this in grad school. Some grad school lectures. Oh, I worked for Linda Mood Bell.
Someone shared that they actually have dyslexia. I know someone said they have a family member with dyslexia.
Well, someone took OG trainings. Very minimal. No classes. Okay.
Awesome. Well, how about
Very
like,
nice.
I know when I was in grad school, we definitely addressed dyslexia, but I don't think there was like a specific class on that where I went. How about you?
Okay, yeah, so this is a great way to get started. So my experience working with students with dyslexia actually started in graduate school. So I went to grad school out in Boston. I went to the MGH Institute of Health Professions. And I remember starting, and in our first semester, we had our in-house clinic practicum along with classes that related to it. And we were able, that's when I was introduced to the Orton-Gillingham approach. One of the students that we had to see in our in-house practicum was a student with dyslexia. And that's kind of when I was first introduced to it. And then once I graduated, like I said, I spent 3 years working in a language-based learning disability program in a public school right outside of Boston. So that's kind of when I decided I wanted to specialize in dyslexia. And I was fortunate to work with the reading specialist in our school who was an Orton-Gillingham fellow. So when I talk about my experience with specializing in dyslexia and becoming certified in the Orton-Gillingham approach, I did it through what is called the Orton-Gillingham Academy. It used to be called the Academy of Orton-Gillingham Practitioners and Educators, which was just very long that they changed it to the Orton-Gillingham Academy. However, I recommend if you're interested at all in learning more or learning how to specialize in it or becoming certified in it, the first place that I recommend you look is at the International Dyslexia Association, or the IDA website. What I love about their website is they break it down into two main categories. They have a really good list of university programs and then another really good list of teacher training programs that are both accredited by the IDA. So whether you're interested in getting, another certification from a school, or if you're interested in a specific teacher training, that's where I recommend you go. And that can help you find different, either different websites or different schools, and help you kind of search by the area that you're in. Now that we're in the age of COVID, I know a lot of places are offering classes online, but if you want to specialize in it, that's where I recommend you start.
What was the website again, in case anybody missed it?
Yeah, so it's the IDA website, which is the International Dyslexia Association.
Great. Thank you for sharing that.
Mhm.
So, do you think this is the best place to talk about completing the Orton-Gillingham certification, or do you want to wait till we get?
Yeah, so I can certainly share so again, I have only had experience, and I know that the IDA's website has really great, all of the programs on there, or all of the approaches that you can potentially go through are really fabulous. The one that I have experience with, like I said, is the Orton-Gillingham Academy. And they have a few different levels of classes that you can take. The first level that you can take is called the educators course. And I first took that course when I started working in the public schools. And it's a really fabulous course, and it gives you a really strong foundation to start teaching and using the Orton-Gillingham approach in the school setting. So working with larger groups of kids who have language-based learning disabilities, who have dyslexia, or who are just struggling to read. Because that's what's great about the Orton-Gillingham approach, is it's not just for kids who have dyslexia, but the strategies that you use are really beneficial to all kids who are learning how to read. So there's that first level of educator course. The most recent one that I have done, and the first level of course, is called the associate level course. So that was I believe it was a 60-hour course that I took. And then once I was done with the course, I had to complete a 100-hour practicum. And the practicum is honestly, a lot of people were like, should I do the practicum? Should I not do the practicum? I felt like I learned the most from the practicum. I worked with a student one-on-one, and I had 10 of my sessions I recorded, and then my supervisor would watch my sessions, provide me with feedback, give me tips on what to do next. And then at the end of it, for my application process, you have to write up a student profile. You have to talk about, the baseline data that you collected, kind of the growth that they have done. And you have to write up a couple lesson plans talking about the process that you did and why you made decisions in the lessons that you were doing. And then I actually just submitted and found out over the weekend that I had gotten submitted, or excuse me, not submitted, that I had gotten approved and accepted. So it's definitely a long process, but it's a very rewarding process. And like I said, the practicum is where you learn the most. So I highly recommend doing that. Afterwards, you practice for a couple years. The next level is the certified level. And then there's the fellow level, which comes after that. And the fellows, I mean, it's like 10 years down the road. So certainly not something I'm thinking about right now, but definitely a great experience.
Wow. So, are you going to go all the way, you think?
I don't know. I really enjoy the fellow that I'm working under right now. She's absolutely wonderful. So I think I'd love to continue to learn under her. Um, I don't know though. We'll see.
To be continued, right?
Exactly.
Awesome. So let's talk about the different strategies that you would use for treating language-based learning disabilities in the schools.
Definitely. So, like I mentioned before, I worked for 3 years in a public school and I worked specifically in the language based learning disability program that we had. So, our special education director, she came up with this program to keep a lot of our students in the school, to keep them going to their public school. And it was a really wonderful program. So, I helped not only do the one on one reading tutorials, but I also helped out with the study skills class and with our English class. So these are a lot of the strategies we use with our kids in those classes. So strategy number one is to explicitly teach and practice the writing process. So we know that dysgraphia can co-occur with dyslexia, which is why it's so important to explicitly teach the writing process. If you're interested in learning more about writing, a book I highly recommend is called The Writing Revolution. It's a really fabulous book. It's on Audible too, if you want to listen to it. They also have courses if you want to learn more about just the structure and how to teach it. Um, but to go more into this specific strategy, when we talk about the writing process, the first thing we want to do is teach these kids the pre-writing process. So we want to teach them how to brainstorm. We want to teach them that once they get their brainstorming ideas out on paper, how they can then organize these thoughts. Brainstorming out loud is really important for these kids. I really like the idea of it's called brain frames, but it's a way in which you can organize thoughts and kind of help kids create their own graphic organizers. And something that's really important with these kids too is explicitly teaching them how to use graphic organizers. We saw a lot in our schools. Some of the teachers would give kids graphic organizers and expect them just to independently use them and to independently turn this graphic organizer into a beautiful 5-paragraph essay. And there was so much breakdown there because kids didn't know how to use this or the process to use it, and they would get so stuck. So I really recommend focusing on that pre-writing process. Once you're done with that, you go through the whole writing process. So you write that rough draft, you revise and you edit it. You teach them how to revise and edit their own work, working with peers, and understanding that it's going to take multiple drafts. My second strategy that I recommend is teaching and practicing reading strategies. So oftentimes these students that we're working with will spend a lot of time and a lot of energy decoding the words that comprehension isn't going to come as easy to them. Comprehension is definitely going to be a challenge for them. So I'm going to share 6 really great comprehension strategies that I got from the Orton-Gillingham fellow that I was working with in Boston. The first strategy is making connections. So teaching these students making connections to their own lives, making connections to other texts that they have read, making connections to things that are going on in the world. Definitely a great strategy. The second strategy that I love is asking questions. So if they're unsure about what's going on, teaching them that it's okay to ask questions, ask those clarifying questions, giving them the language to provide those questions. Next is visualizing. So encourage them to draw pictures or orally describe what they visualize the story to be about. Encourage them to talk about their emotions. So strategy number 4 is talking about their emotions. Did the text elicit any emotions for them? Next is vocabulary. So we would always try to either maybe we saw some familiar root words that we had learned and we would talk about those vocabulary words, or they could identify maybe a vocabulary word that they didn't know and we would practice looking it up in the dictionary together. So rather than me providing them with the definition, they could use resources to find the definition of the vocabulary word. And then the last strategy would be making predictions. So things that most of us as fluent readers, we do these strategies or we think about these things without being prompted, but these kids often need these sorts of prompts in order to really dive in and comprehend the text that they're reading. The
Awesome. Wait,
last,
can we
oh,
stop
yeah,
there for
go
a
ahead.
second? I have some follow-up questions, and I think some other people did too. I just want to summarize you said 6 strategies that you just mentioned, right?
Yes.
Okay, go ahead and can we mention that? I'll go ahead and see if I got it correctly. I know I missed the first one because the question came in, but I think strategies were ask questions, visualize, emotions, vocabulary, such as like finding the root word, and then making predictions. And what was
And
the
then
other
the
one?
last one is connections.
Connections. Okay, great. And then you were talking about graphic organizers and saying that maybe some aren't appropriate or there's a breakdown in the type of organizers we're giving and then the child being able to complete it by themselves. Is there like a certain type that you recommend, or how do we bridge that gap from giving the activity and having them complete it?
That's a really great question. So I know we would always try in the school to use what the general ed teachers were using because we wanted to make sure that these kids were using the same sorts of things so that when they would eventually go into the general ed classes, they were able to use the same things. However, sometimes that wasn't always possible, which is why I do recommend, if you want to learn more about it, I recommend looking up brain frames. I'm actually taking, we had like a professional development in the school, but I'm taking a refresher course actually this summer online. And what I love about brain frames is rather than a lot of our kids, especially the ones who struggled with handwriting, graphic organizers, you might have a little tiny box, and these kids who struggle with handwriting would have to fit their word in this little tiny box. Or there would be 6 blanks, but my students could only come up with 5 ideas. And there was just this block where it's like, I can't move on because I only have 5 ideas, but there are 6 empty spaces. And what Brain Frames is really great about is you teach the kids to, the graphic organizer is created off of what they have in their mind and the number of ideas that they have in their mind. And then they really stress writing and then drawing like the circle or the square around after it.
Mm,
So I think to learn more about graphic organizers, that's definitely what I recommend.
that's awesome. Thank you for clarifying that.
Of
So
course.
we had a couple questions come in. Let me pull it up. Deborah, that question we're going to be answering towards the end about billing insurance or
Yeah.
private pay. So we'll get to that. Lisa had asked, were you able to complete your practicum? Would a working SLP be able to complete the OG practicum while working in the public schools using a student as a client for the practicum, or does the practicum require working with a client outside of their job?
That is a fabulous question. So I think that you can certainly do the practicum with a student as long as they fit the profile. So either a student with dyslexia, or if they haven't had a formal evaluation, I know the fellow that I was working with, if they have characteristics of dyslexia in any setting, it would have been totally fine. I believe in the school that I was working in, the OG fellow, I know that she, after I had left, was actually observing the SLP who replaced me and observing her in her sessions in order for her to complete her associate level training. So it's absolutely something that can be done within the schools. My only suggestion would be to first double check with the parents. I just got approval from the parents that it's okay that I record and share 10 of our sessions. And then I think as long as it's okay with your, either your special education director or your principal, I think it's totally fine to do in the schools.
Awesome. And then the next question we got was, should the strategies be followed in order,
Nope.
the strategies 1 through 6?
Nope. And I've definitely, even with those strategies, sometimes we would have like a chart or a little reminder for the kids, and their homework would be to go home and to answer maybe 1 or 2 of them. And they could choose whichever comprehension strategies they wanted to do. So there's no particular order.
Awesome. All right. And I think we left off on strategy 3, right?
Yes. So strategy number 3, let me just close this box. Okay. So the third and last strategy is encourage these kids to use their learned decoding strategies. Oftentimes, unfortunately, these kids are taught take a guess at the word based on the picture, or take a guess at the word based on the first letter. And unfortunately, these strategies can really frustrate kids with dyslexia because they're not effective strategies. So if we have taught them learn decoding strategies, whether identifying syllable types or different syllable division strategies, encourage them to use those. And if it's a word that you haven't taught them, go ahead and provide it to them. Go ahead and give them the word and have them repeat it. We don't want them to get frustrated trying to do something that we haven't explicitly taught them. So definitely encourage them though. If you know they've learned the strategy, teach them and encourage them to use it.
That's really interesting. Thank you for sharing that. We have
Mhm.
another question that came in. It says, as an SLP in the school, are goals written into the IEP that address dyslexia different from the normal language goals?
I think I would say yes, they are at least. And again, I'll go into this a little bit more later. I really think how goals are written either by the SLP or by the reading specialist or the literacy teacher, it really depends on the setting that you're in. When I was in the schools, and for the students who I provided their reading instruction, I did write the goals differently than normal language goals because we were working on specific reading and decoding things that were very different from their normal language goals. There would be some overlap. For example, if they had specific phonological or phonemic awareness goals, that's when there might be some overlap. But overall, they were written differently on the IEP, yes.
Thanks, Lauren.
Mhm.
All right. So what is the Orton-Gillingham approach? Let's break it down.
Yes. So it seems like quite a few of you are familiar with the Orton-Gillingham approach. Is this correct? If we ask people to answer in the chat, have most of you at least heard of OG or heard of structured literacy?
I'll be honest, I didn't hear about the Orton-Gillingham approach until I had my first guest come on and talk about dyslexia, and then, you, Lauren.
Okay. Okay, great. So yeah, some people, yes, some people know, have heard the name, never heard of it. My daughter completed a course. Fabulous. Okay, so it's good that we have a wide variety of answers there. So when we talk about the Orton-Gillingham approach, before I go into the 6 principles of it, I just want to talk about the fact that it's an approach. It's important to remember that it's not a specific program or a specific curriculum. There are certainly really, really, really great reading programs out there, reading programs that have been developed by Orton-Gillingham fellows, reading programs that follow more of a specific scope and sequence. Again, I'm speaking to what I'm familiar with, which is through the Orton-Gillingham Academy, where fellows teach us more of an approach rather than following a specific curriculum. But going into the 6 principles of it, principle number 1, again, these are not in any specific order, but number 1 is that it is systematic and sequential. So what does that mean? It means that lessons follow overall a specific order and they build on previously taught materials. So again, it's not a very strict scope and sequence that we follow, but overall there's a rough, we're not going to teach more complex syllable division to students before we teach the basic syllable types. And again, we're always building on previously taught material. We're always spiraling back and reminding kids, oh, this relates to this. Next, it's multisensory. So we really want to incorporate as many senses as we can. We want that visual, auditory, tactile, and kinesthetic cues, techniques. We want to involve all of them in our sessions as much as we can. Orton-Gillingham is prescriptive. That means that instruction is based on the needs of the individual child. It's diagnostic. So as we are teaching our students, we're consistently assessing their abilities and we are developing our lessons based on their current abilities. We also want to ensure that we are teaching to mastery before we move on to the next concept. So a phrase that I really like is this idea that we will go as fast as we can, but as slow as we need to go for our kids. So that means if one of my students, I notice, it's been 2 or 3 lessons now that they're really struggling with the EA vowel team, that's going to remind me, okay, we need to have a focused review lesson. We're going to not keep going in our scope and sequence. We're going to pause. We're going to do a focused review on this, make sure that they have it to mastery, and then we can continue to go on. So always looking at our data, always using that data, always remembering that the students are going to drive the bus. Orton-Gillingham is explicit. So we don't encourage guessing, but instead we are going to directly and explicitly teach all of the concepts that we are learning. So we're going to explicitly teach the letters that make a new sound, explicitly teach the syllable division that we're working on. Any concept, we will teach it to them. And then the last one is that Orton-Gillingham is flexible. So we can certainly change the direction of the lesson based on the student's performance, or not the specific lesson, but like I said, kind of change the direction of the instruction in general based on how they're doing.
All right, awesome. I had a couple questions, so I'm going to go back to this slide. You said that it's systematic. Where can we find the order of that information? I'm guessing maybe some curriculums have this laid out for you, but is there like maybe a free resource where we can find that information?
So this is a really great question. I also saw, and I'm going to tie this back to someone who I see making a comment in the chats, who said that they're trained in Wilson, which was created by Barbara Wilson, who is an Orton-Gillingham fellow. And while there are many different fellows have a little bit slightly different philosophies about specific orders that things can be taught. So my Orton-Gillingham fellow provided me with her scope and sequence. However, I know if you were to, a lot of these things are available online. So I believe if you were to look up, I'm not 100% sure, but I believe if you were to look up like Wilson scope and sequence, you can probably have a rough idea of the order in which things are taught. I also know there are a few very fabulous Orton-Gillingham trained practitioners who have shared their scope and sequence on Teachers Pay Teachers. I can look specifically more at a couple of them and share those later with you, Vanita, if you want to pass those on later. But I do believe it's based on either the fellow that you're working with or the program or curriculum that you're working with.
Okay, so what if someone's not trained in Orton-Gillingham and they're working in the schools and they don't know where to start? Like, where should they look for that information? I'm guessing some schools who have good reading programs and a reading specialist or an SLP who specializes in dyslexia can support them. They would provide that information for them. But if they don't have that support, where do you think they should start to find that systematic order?
So like, I think, and I can share, like I said, what I'll do is I'll go ahead and we can add it to the list of resources at the end. But
Okay.
one of them, her name is Emily Gibbons, and she is trained, she's at the certified level at the Orton-Gillingham Academy. And I know she has shared her scope and sequence on, I believe it's on Teachers Pay Teachers, and if it's not, on her blog. And she creates incredible resources. And I was going to talk about her later, but I'll certainly talk about her now. She has really fabulous resources that if you're looking to just slowly dip your toe into Orton-Gillingham, learn a little bit more about the approach, learn about certification, learn about it all, her blog is an incredible place to start. And I think her blog will certainly link to a very good scope and sequence that you can look at.
Okay. Thank you so much.
You're welcome.
I appreciate that. And then you said that the concepts are taught to mastery. What is mastery like considered in this case?
So mastery, what I work off of is the concept that we are learning. I want them to at least be able to decode the set of words that we are working on with 90% accuracy. And I typically will not introduce a new concept 2 sessions in a row. So it'll usually be, we'll teach a concept, we'll at least review for 1, if not 2 sessions after. Again, it's all the kids are driving the bus, so it depends on how well they're doing. But I'm looking for that 90%.
Okay. Thank you. So we had 2 questions come in. I'm going to address this one first. Can you repeat the name of that blog for scope and sequence?
Yes. So it is called The Literacy Nest. And the woman's name is Emily Gibbons. She's out of Massachusetts. And she, like I said, is absolutely incredible.
Awesome. And we do share that at the end too. So that'll be repeated. And then another person asked, have you observed the OG approach in private practice setting, or is it mostly isolated to school-based settings?
So I have done both. So I used the Orton-Gillingham approach for the students that I was working with in the language-based learning disabilities program. And for the past 3 years, I've been doing it in a private practice setting.
Great.
Does that answer that question?
I think it does.
Okay.
If it doesn't, go ahead and write in the question and answer again. We'll make sure we address it.
Yes.
All right. So and then here we go, private practice. What are some considerations for treating dyslexia within this setting?
Yes. Okay. And I know that I believe this was a question that was asked earlier. So my first consideration for treating is, from the experience that I have had and chatting with other SLPs in the area who treat students with dyslexia, is be prepared to be private pay only, or at least tell families that it most likely will not be covered by insurance. I know some SLPs definitely write more language-based goals and have gotten those covered by insurance, but I've heard that it's very rare. So I am private pay only, and the other SLPs in the area who I have talked to are all private pay only. And they've said that, like, yeah, based on the research that I've done, insurance most likely won't cover it. Um, yes, so be prepared. My second consideration is brush up on your special education laws in your area. So I think this is important in general when you're working in private practice, but I think specifically with this population, because from my experience treating not only in the schools, but working with some families here, going to some IEP meetings here, the use of the word dyslexia or specific learning impairment in the area of reading, it's how school districts use it is very different based on the area that you're in. I would say that because I am private practice and private pay only, I am able to qualify a student to be more, or excuse me, I'm able to qualify a student more, and I would say be more individualized than a school can. I've had many parents come to me looking for services because they say that they have seen that their child has really low reading scores, and maybe they don't know how they can approach the school to ask for an evaluation, or they've gotten an outside evaluation and they don't know how to present these results to the school to either ask for accommodations, or they don't know how to ask for services. And I mean, as we all know, when a family has an outside evaluation done, the school can take the results of that evaluation into consideration, but they're not required to act on it. So I think if you are going to work with these students in a private setting, definitely be prepared to kind of guide families in a way in terms of helping them either interpret test results or work for accommodations or services that their student might need. And then the last one is slowly build your resource library, especially if this is a new area that you're interested in going into. It can be overwhelming thinking that, like, where do I get my resources? What do I need to buy? How do I even start? Like I mentioned, I think that the Teachers Pay Teachers has really great resources, especially Emily Gibbons, like I mentioned before. But don't feel like you have to buy every book or set of note cards. Or I remember when I was starting off too, I felt this pressure of, like, what set of decodable readers do I need to get? Like, there are hundreds of different sets that I could get. What do I need? And I remember confiding in my OG fellow, and she said, like, start off with this very small set. I think I started off with like 5 books, and it was perfect for what my students were working on at first. And then slowly, as we've kind of continued along in our scope and sequence, and they've started to learn more, my library has slowly grown. There's also a lot of really great free information out there where you can kind of take it and you can make it your own. So definitely don't be overwhelmed and just slowly build your library, get the basics, and then you'll be good to go.
Awesome. Thank you for sharing that. And you're going to share your go-to resources at the end as well.
Yes.
I don't think we talked about this in our first interview that we had. So I have a question. If someone wants to, start maybe private practice on the side, or they have a private practice and they want to start seeing more clients with dyslexia, what assessments should they be investing in or, looking at getting?
So do you like standardized assessments? Because I'm going to answer this question in 2 ways.
Okay.
So the first one, there are quite a few. When I have new kids come into me who have already had their diagnosis of dyslexia, I usually will just do some baseline assessments, and a lot of them are available out there for free. So one of them is called, and I can also email these to you later so that we can share them. I do the Gallistel-Ellis, and it's a test of decoding. So it breaks up words based on the pattern that kids have to read. So it starts off with basic closed syllables, and then there are some silent E syllables. And it's a really good way to just get baseline data on kids. I usually do a basic spelling test. There's one in the book called Words Your Way or Words Their Way. I can't remember which one it is. They have a really good spelling test. I do the past, so a phonological awareness assessment. You can just do a basic Fry words assessment or a Dolch words assessment to look at some of those high frequency words with kids. So there are a lot of really good free resources to just get baseline information if kids already have a diagnosis of dyslexia. If you're looking to start testing, some tests I recommend are I'm looking down at my test right now. There's the CTOP. I recommend the GORT. So there's the gray oral reading test. I really like the gray silent reading test. The RAS, so rapid automatized naming or automatic naming. A new one, a relatively new one, is called the TILS. And what I really like about the TILS, so it's the test of integrated language and literacy skills. And what's great is on their website, they have really helpful videos and tutorials to help you administer the test and to help you interpret the results. So those are some, oh, and the test of reading comprehension is one that I really like as well.
Great. Thank you so much for sharing those.
You're
No
welcome.
questions came in. So the first one is, have you used or have you heard of someone use the OG approach with a bilingual student with dyslexia?
I have not. I do not have any experience with that, unfortunately.
Okay. What we can do is I'm going to put this on a list of questions that we haven't answered, and we will, if we can't answer it tonight, we're going to try to address it and then get back to you. I know it's anonymous though, so I don't know if you want to just message me privately. You can send it in the chat to panelist with your name or email, and then we'll get back to you about that question. The next question I see is by Lisa. It says, what is the reason that dyslexia is not typically diagnosed, evaluated for in public schools? I've encountered multiple students now whose parents, case managers say they have dyslexia, but we don't conduct dyslexia assessments in our district.
That's the $1,000,000 question. And I've had this conversation with other SLPs in my area who, with their other private practice SLPs, we've chatted and we've asked. I remember reaching out to her and saying, like, I had a family who contacted me who pretty much said, like, I um I think that my daughter's really struggling and they won't test her for dyslexia. And there's actually so I don't know why some school districts won't do it. I know that some school districts will. They will test kids. They will give them that, that diagnosis of specific language impairment in the area of reading and writing. I know that when I was in the school district, it was something that our school psychologist, she did it. She evaluated it in combination with, I would do the language testing. Our reading specialist would do some of the reading testing, and we would do it. So I don't know the answer to that question. A few months back, I remember I saw this on a Facebook post, and again, it was done by Emily Gibbons, but she recommended, she's like, go to your school district's website and in the search bar, type in dyslexia. And the answers were just really fascinating to me. And I think they were really interesting to everyone who was reading it. And I recommend that it's something that you all do as well, just to kind of get an idea of whether or not it's even called dyslexia, what they call it in your area, what resources are available. I'm really proud to say that Colorado has a really great dyslexia handbook. The Colorado Department of Education, I believe the handbook's over 100 pages, and it's just a fabulous resource if you're interested in general in learning more about it, and kind of the process. It's something that, for families, it can be a lot, but they break down a lot of the characteristics of dyslexia, a lot of the special education laws. But I do think it really depends on your district and the area.
Yeah. Someone said that some districts address it only through regular education or 504, not through special education. Someone else said starting this next school year, the state of Kansas is requiring screening for dyslexia for all students starting kindergarten. So that's nice to hear.
Right.
Same reason we don't diagnose ADHD. My understanding is that it's a medical diagnosis. We can have findings consistent with the condition, but we're not supposed to label it as such. And then someone else says school districts tend not to use the term dyslexia as it is a medical diagnosis, but can use a descriptor used like specific learning impairment in the area of reading.
Exactly. And that last one, that's what I've seen on a majority of the IEPs where kids have it, is they will have that the way that it's labeled there. Exactly.
Okay. We did have some other questions that we didn't address yet, which was, do you have many students diagnosed with autism and dyslexia?
Personally, I do not. So again, that is not something that I can speak to.
Okay. And then that's another question I'll put in the unanswered column where we will try to get back to you guys about it. Maybe I'll do like a follow-up email with some of the unanswered questions. Someone said, how did you use the books? But I'm not sure what she means by that. Do you know, Lauren, or do you want to have her clarify?
If she's talking about potentially like decodable readers, like for example, primary phonics is a group of decodable readers. It can be something where, there are books developed where there's a primary phonics book that only has it focuses on the eval team. So it's just a very controlled text that's going to have a lot of the specific concept that you're working on. I'm not sure if that's what she's referring to, but yeah, if she could clarify.
Okay. All right, let's see. She might have clarified. I saw another one come through. Okay, here. Using books for decoding, that answered it. Okay,
Okay.
perfect. Good.
Yeah.
I'm glad that you got that. Another question that you received is, do you have many students that are EL and are also labeled with dyslexia? And if yes, how are they tested?
No, I cannot speak to that.
Okay. All right, we'll leave that in the unanswered one as well. All right. So, was there anything else that you want to talk about in terms of the private practice setting, or do you want to
Oh,
go ahead and move on?
yep. So we can go ahead and move on.
Okay, awesome. So, what are some special considerations that SLP should keep in mind when treating this population?
Okay. So the first one I would say that is because dyslexia is a difficulty with language processing. I think it's fabulous that SLPs can really bring a lot to the table when treating these students. One example would be helping students strengthen phonological awareness and phonemic awareness skills. We as SLPs have a really large toolbox, and we can help these students in a lot of ways. Where I remember being in the schools and having the reading specialist consult me with many of our kids, because it's just we have a unique background. So I think we can really provide a unique perspective and help these kids in a very unique way. Another example is we can help kids improve their vocabulary when we're writing our word list for kids to read. We can really help them with some vocabulary strategies and help them build their vocabulary in different ways. And then relating that to morphology. So lots of what we do can be applied to kids with dyslexia. The next one I would say is, depending on your state, ASHA says that SLPs can assess for dyslexia. This is something that is relatively new. And I would check with your state, but if it's something that if you have practice, if it is something that you feel comfortable doing, certainly with practice, with this experience, I wouldn't just jump right into it. But it is something that SLPs can now do. And then finally, I would say, most importantly, as we do with all of our kiddos, is take the time to recognize their strengths and really use them to your advantage. So if you know that your kid, I remember I had a kid who really enjoyed hockey, and they had a hockey game coming up. And one day, I forgot what we were learning about, but I tried to throw in some vocabulary words all related to hockey that's still related to what we were learning about. Again, it requires some creativity and some planning. You can always tie in their interests, also tying in their interest when it comes to that multisensory piece. So if we're reading and they really enjoy, they're active kids, maybe have them go. I've had kids recently where we go outside and we're going to just write with chalk outside because it's a nice day. Or if we're including those visualization strategies because they're kids who like to draw, really play up to their strengths. It not only engages them more, but it really helps that multisensory piece too.
Thank you so much for giving me an example of like how you would incorporate that multisensory, because I know we talked a lot about that in the last interview we did, and we didn't talk about it that much here. So can you give another example of like how you would incorporate, different senses in a particular lesson?
Yeah, certainly. And I can actually, I guess since we have a little bit of time, I can talk a little bit too about what a lesson might look like, and talk a little bit about how those multisensory pieces are kind of pulled in the different areas. So when we think about what an OG lesson is going to look like, again, it's individualized based on the student that you're working with, but overall it follows a relatively similar pattern every session that you have. So you're always going to have some sort of phonemic awareness practice. And then we do what's called a visual drill, or phonogram cards. So this is where we're giving students you can see me, right? Can I hold up an example of a card?
Yeah, I can see you. If
Okay,
anybody
if
can't see,
not,
you're
it's
just
okay.
yeah.
I was just gonna say the visual drill, it's where you provide the student, let's say I hold up the letter A, And my student has to tell me, oh, A says and A. So they have to then give me, they're reading it, they're taking it in visually, and then they have to give me the sounds that they know that grapheme makes. So another example would be they see E-E, which would stand for E consonant E. E consonant E is a silent E syllable. It says E. Once we're done with our visual drill, we're always going to do some review of previously taught materials. Typically what this looks at is if they make some sort of decoding or reading error in their previous session, we're going to bring it into that next session too. So maybe we're reading our novel, they missed 4 or 5 words. I take notes of those, I bring them in, we review those words in the next session. Again, I'm taking data on it and see, oh, this is like the second or third time we've missed this. I'm going to make a note to bring this into the next lesson as well. Then if it's appropriate, we're going to introduce new material. So this might either be a new grapheme that we're learning today, or it might be a new spelling pattern or a new spelling generalization. It could be a new syllable division pattern that we're learning. Wherever we're at, we take that time to really explicitly teach them and give them words based on the rule that we're learning, or spelling words based on the rule that we're learning. We're always going to do some sort of syllable division or morphology practice. And then we're going to do some practice with learned words or sight words. And this is where that multisensory piece is really important. So this is where students might write in a rice tray, or they'll write in a sand tray, or we'll do some sky writing. There are a lot of fun sight word games that you could find to incorporate movement, to incorporate multisensory. I've done shaving cream before. A lot of this was pre-COVID, but still lots of things that hopefully we can do again. We're going to do some fluency practice, or we're going to read some sort of controlled text. We're going to do some handwriting practice. So again, this can be a fun way to do handwriting practice where, we might do our handwriting one day on a bumpy board. We might do it another day, like I said, with chalk outside. We do a lot of cursive practice too. I really like handwriting without tears as a cursive curriculum that I've been working on. Then we do some spelling dictation with words or sentences. And then this is where we do the opposite of the visual drill, which is called the auditory drill. So again, working on those different senses. So the last time with the visual drill, again, they see the letter and they have to give me the sounds. The other side of the coin, I give them the sounds. So for example, I might say, what says A? And then the student would repeat the sound back to me. So I know that they're listening to it. They repeat it back to me. So I ensure that they know it. And they would say A. They would say A consonant E, A-I, and A-Y say A. And at this point, I might say, great, when do we know to use AI? And they would say, AI says A at the beginning or the middle of a word. And then I could say, okay, great, what is our key word for AI? So oftentimes we'll use a keyword when students are first learning a new concept. We'll introduce them to a keyword to kind of provide them with the keyword and a picture to give them some sort of, another memory strategy to use it. I see someone here that the Wilson curriculum has letter, word, sound. So exactly. So it's the same sort of thing where you're going to give them the letter. Depending on where the student is at, they would then have to give the letter and then the keyword and then the sound. Sometimes you can take away that keyword. Sometimes you add it. It again, all depends on where the student is in their learning. Again, we would do some spelling and dictation. At the very end, we usually finish with 10 or 15 minutes of reading. All the kiddos I'm working with now, we're all just reading a novel, and it's a really fun way they can see these words in real life, and just a fun way too to practice comprehension and get some good reading in at the end.
That was so helpful for me personally, just to kind of see, like, be a fly on the wall and what your session looks like. I know I kind of drilled you a little bit on the scope and practice, but I think that this really helped, like, someone who's kind of just getting started out to see like what a lesson would look like. So I appreciate you explaining that.
Yeah.
You did see the comment about the Wilson curriculum. Someone had said, is dyslexia different from learning disability in reading and writing and definition? Are there unique characteristics?
So to talk about this, so I know someone mentioned earlier that when we talk about when it's on an IEP, we're not going to see dyslexia. We will see typically specific learning impairment in the area of reading. But when we talk about a learning, I would say the jargon when it comes to IEPs, they're different, but although they are the same overall with the characteristics. But to elaborate on that a little bit, ASHA has a really great um, ASHA has a really great chart, I would say, that I'm trying to find, where did I can send you the link, Vanita, that has ASHA's really good chart. And what I like about it is, oh, it's called Disorders of Reading and Writing. And this ASHA chart breaks down the disorder and the primary language domains that are affected. And they also mention too that, although the descriptions are broken up, oftentimes students will have difficulty in more than one area. So difficulty in decoding will often result in comprehension problems, or you might have difficulty in decoding, which would mean difficulty in reading fluency. So this chart is really great because you can kind of sort things out and look at it based on, like I said, the specific language domain that is affected. So I hope that answers that question.
Yeah, let us know if it didn't. And I know we have a couple of minutes left, so I want to get through this and then we'll address some of the questions that came through. Let's see. Okay, yes. This is like the last slide before we get into like the giveaways and stuff, you guys. So I wanted to share this just in case. So Lauren, go ahead and tell us about your favorite resources for dyslexia.
Yes. So the first one, like I mentioned before, the International Dyslexia Association, or the IDA website. There are different branches of the IDA too. So if you're interested in becoming involved in the IDA or learning more about it or becoming a member in your specific area, like I'm in the Rocky Mountain branch of the IDA. So see what's available in your area. They have a really great portion of their website that I think are called their fact sheets. And there are these really great summaries of everything from appropriate accommodations for kids with dyslexia, assessments in dyslexia, ADHD and dyslexia. And they're really wonderful, like 1 to 2 page summaries that if you just want to learn some specific information, I recommend going there. And again, they also have those 2 areas where you can learn more about becoming more specifically trained. The next one is a really fabulous book. It's long. I actually listened to it while reading and highlighting. It's called Overcoming Dyslexia. It's a really great book. Again, Emily Gibbons from the Literacy Nest. Her blog is just such a wonderful place, similar to the IDA website, where you can find some really great information, some really great tips on, she has great tips on how to make the visual drill more interesting, or how to talk to families about this, or what does mastery look like. She has really fabulous blogs. And then the last one, again, what I'm familiar with and where you can find trainings either in your area or trainings that might be offered online, is the Orton-Gillingham Academy. They have a really good overview of the different levels of training that they offer. And then they also have a separate area that breaks down all the trainings based on the fellow and the area in which the fellow is providing the training. So when I talk about a fellow, they're the person who teaches. They have people under them who they teach. And so they are located all throughout. I'm not sure if it's all throughout the world. I know all throughout the US, you can certainly find a training near you, or I believe quite a few are happening online this summer.
Awesome. Thank you for sharing those resources. All right. And this is where our question and answer session is. And I know we had some questions that we left unanswered, so we'll address those. But what's your big takeaway, Lauren?
My big takeaway is that dyslexia is a language disability. It is a difficulty with language processing, and it is not a vision problem.
Why is that like a concern? Why is that something you have to like mention?
I think a lot of people, there are some myths about dyslexia where, dyslexia is just seeing, letters written backwards, or, letters or numbers in the wrong order. And I think a lot of people kind of oversimplify what it is, that it's just like, oh, it's a problem with your eyes. And, if you go and see an MD, they can help you out. And it's certainly more complex than that. And it's the underlying language, it's the underlying phonological and phonemic awareness. And we work our way up from that.
And I think that also makes it clear that the SLP plays a big role in it.
Absolutely.
As well.
Yes.
Awesome. Okay. So someone asked, how long would a session be, for example, the example that you gave?
So I recommend, and I was actually, when I was completing my my practicum, I was recommended that my sessions be between 45 minutes and an hour. You know, I have a couple students who have attention difficulties where we go closer to that 45 minutes, but usually 45 minutes to an hour, and I usually do at least 2 times a week.
What about in the school setting?
In the school setting, it honestly, I would say it all depends on caseload size, and I know that that's such a it's very variable. When I was in the school, again, I was in a very small district. I saw my kids 5 days a week. We were on a 6-day cycle. I saw my kids 5 days a week for 50 minutes. I know around here, they do some small group instruction, so probably 4 or 5 kids, which OG can easily be done with that size of kids. And I think they're 2 to 3 times a week.
Okay. In the school setting, the educator can play a big role in the implementation as well. So even if you can't see them that much, maybe you do what you can in your sessions and then give them the strategies as well.
Yes,
Um,
exactly. Even when I took my course, I would say half of my class was they were teachers. They were teachers who their school district sent them so that they could start using the OG strategies in their classroom. And it was fabulous.
yeah, someone did say at the school I work, especially a school for children with dyslexia, our Wilson sessions are 1 to 1.5 hours every day.
Amazing. That's fabulous.
All right. So someone said, is there one certification that you recommend when starting as a new CFY?
I think it depends on the kids that you're going to be seeing. If you're in a school where you're going to be seeing small groups of kids, take a look at that educators course from the Orton-Gillingham Academy. That's where I would definitely begin. That's what I would recommend.
Okay. And then someone had asked, have you used the Lively Letters cards?
Yes, I have them actually right over here. I have them right over here. I took the Lively Letters course earlier this year. My OG fellow, she had talked about it and she raved about it. And I find it to be really helpful with some of my kids. So I think that's a really great question.
Yeah. Fun fact, I won them at ASHA and I never win anything. So I was like so excited.
That's awesome.
I don't see any other questions. If you have any, go ahead and drop them in the Q&A section. We're going to go ahead and move on and wrap this up. So stay on if you are wanting to win a gift card, because that's the next slide. But I do want to share this in case anybody is interested in earning ASHA CEUs for tonight. What I would recommend is just taking a screenshot of this slide because there's a lot of information here, but you can get 0.1 ASHA CEUs. If you head to tasseltogether.com/courses, there's just a small $5 fee to earn a certificate. And this is a live course. So I know some states require like a certain amount of live CEUs. So this will count towards that. And then you have until June 25th to complete your requirements. There is no quiz. It's actually super easy and practical. We want you guys to engage in a group discussion where you just share like your favorite strategy from tonight, or you can even ask another follow-up question and Lauren and I will get back to you in the group chat. And we'll automatically submit your information to ASHA for you. All right, now for our giveaway, because I don't see any other questions.
Oh, I actually see two really quick.
Oh, you do? Sorry. Let's address
No, that's okay. So the first one, if the school does dyslexia screening, should those that do not pass the screener be considered for language testing? I would say yes. I would say absolutely, but that's my opinion. And then the last one, are you able to use principles of OG or do you need to be fully certified to use any part of this? No, it's definitely something where you can absolutely use the principles of OG. You can use a lot of these strategies without being, I chose to do the practicum and become certified to get that feedback from my supervisor. But it's something that you can absolutely implement without having the certification.
Okay. And someone said, it's just comments like their favorite strategies are making connections and visualization. So
Awesome.
Thank you for sharing that. All right, you guys, let's wrap up with our giveaway. Lauren, I'll let you choose the Q&A winner and I'll tell you guys how you can get the other one from social media.
Yes, so the Q&A winner, I'm going to choose someone who has a birthday closest to my daughter Grace's birthday. So go ahead and enter your birthday. I'm going to be watching. I won't tell you. Okay.
Oh, we're going to have to do the honor system after you guys enter it in because I think there's going to be way too many entries.
Yes. Although I saw someone who was very close so far. I'm not very quick at reading, but
It looks like somebody else said, do you have experience with students while the birthdays are coming in? Do you have experience with students with other challenges such as autism? I think we had someone else ask that and you did not, correct?
I did not know. I mean, some of my kids that I work with now have some underlying, language difficulties or some speech, but no, I do not have experience with autism and dyslexia. No.
Okay. Guys, if there's any other questions that we didn't get to tonight and you're not joining the ASHA CEU group, you can send an email to info@tasseltogether.com and we'll get back to you. All right. You ready to go ahead and reveal Grace's birthday?
Yes, and I believe I saw it earlier up. Someone's birthday was so Grace's birthday is October 9th. The closest I think is October 12th by Deborah Harris, but if someone is closer to October 9th, please let me know.
I saw on October 8th, I think.
Oh, you did see on October 8th? Okay, sorry.
Yeah. Whoever that was, go ahead and
October
enter your
8th.
name in the chat because there's way too many entries. And while they're doing that, I'll tell you guys how you can still have a chance to win the other TPT gift card. Just take a screenshot of the event tonight. Maybe you already took one and share it on social media and you can tag us. So either one of us, Lauren's Instagram handle is here and my Instagram handle is there. I still don't see the person that was the October 8th. So hopefully they'll answer soon. But that's a wrap, you guys. Thank you so much for joining us tonight. I can't believe we hit capacity. I feel really bad for people that weren't able to join this, but make sure you share with them if you have any friends that will be on the Speechy Side Up podcast. And yes, that's a good question. If your account is private, do I see that you tagged? I'm not sure. I don't know how to answer that. I'm sorry.
I think if they maybe take a screenshot of tagging it and then send you the picture.
There you go. Look at you, problem solver.
Oh yes, that's what someone else said too. I think you have to screenshot and DM you.
Okay. It looks like the October 8th that I thought I saw didn't come through. So October 12th with Deborah, you said Deborah Harris?
I think Deborah Harris. Are you October 12th?
Okay. Yes.
Oh, there she
All right,
is.
Deborah.
Yeah.
It's all you. So Deborah, send me an email and we'll make sure we get that TPT gift card to you. Thank you guys so much. I know we went a little bit over, but we really appreciate you guys joining us. And like I said, if you have any follow-up questions, feel free to email it as well. Have a great night, everybody.
Bye.
Bye.